right, we are back. We are live. Saying the phone number spurred a couple phone calls. I usually try to take them on the air so you can hear the questions. I have a friend of mine, Ted. Ted's going to introduce himself and let us know what his topic is. Ted, you are live with my listening audience. Michael Regan, this is Medicare and You. How are you?
Hi, Michael. How are you today?
First of all, from the bottom of my heart, thanks for your friendship. Thanks for always taking such good care of me and my family and my clients. What is your story and what is your company?
Yeah, my name is Ted from B&M Package Store in Waterbury, Connecticut.
Okay.
We're a small, independently owned liquor store in Waterbury, and we have several full-time employees, and we're worried about the new health care coverage that's coming out through Obamacare.
Correct.
And it's very confusing when the information changes from day to day, from newspaper to newspaper.
I couldn't agree more. What's happening is people are just now throwing up their hands. Larry Rifkin, by the way, great show if you're in the car listening. You had a great show full of good guests. The October 1st notification is still required. So Ted is the employer, works for my friend Lucy, but Ted's basically the man over there. He runs a show. I call in, now we're up to about 15 cases of wine for Christmas, right, these days?
Yep.
So I get my wine there. And Ted and I always haggle back and forth. I try to get it, if I buy in multiple bulk, I try to get at least a 50-cent discount on the bottle. He wraps them himself. It's just a good presentation. So I see him, and I drink Bud Light. I go and purchase my Bud Light for the week. And I said, hey, Ted, have you gotten the exchange notice out? And he goes, no. And I'm not his agent. So I say, well, we're friends. Let me tell you about it. I told him about it. And he's like, nobody's informed us of this. Ted took a proactive approach. You actually called your carrier, correct?
Yeah, we got a hold of Anthem Blue Cross and Blue Shield and try to get more information.
And they told you that all that's required is just the front page.
Correct.
Right.
Originally, I think it was a 4-page copy with information, signed by the owner, to our employees, whether we're going to cover them or not cover them.
Correct.
And they needed to be notified that by October 1st. And if not, there was agents going to go into the field and they were going to audit areas and make sure we were compliant with their information.
The agents are actually OSHA, Occupational Safety Health Association. I think that's OSHA. OSHA. But we were told, and we were communicated in our correspondence, that it was a $100 per day fine per employee that didn't get notified. You're now being told by Anthem, the carrier, that there's not going to be an inspection and there's not going to be a fine?
That's what she had told me. And, originally it was a 3-page report that had to be signed and given to each employee.
Correct.
And now they're saying you just need to give the cover letter to each employee.
Okay, so
we have the cover letter with some information that, this is where you have to go to get insurance. If you don't have insurance, we actually offer insurance to our employees.
Right.
And,
Ted, if you don't mind, don't be willy-nilly. Don't be willy-nilly. Give the one that I brought to you from the Department of Labor website. Just do it right, because we don't need trouble. It's changing so rapidly these days that us agents, this is my career. I can't even keep up with it. So just do your due diligence, please. Give the exchange notice to your full and part-time employees today, within the next couple of days when you see them, and just make sure they initial on the bottom, just sign it, something to verify that they've actually received it. If you don't mind, I'd rather be uptight than loosey-goosey. I'm not, if you've seen me, I'm always in a suit and tie. I pretty much shave every day. So I'd rather have this be compliant and be done right. I care about you. I care about Lucy. You've always been good to me. Please get your wines there. They always have good prices. Ted, thank you so much. From the bottom of my heart, I appreciate your friendship.
Mike, I appreciate your help in getting us the proper information to make sure we're covered and our employees are covered properly.
All right. Have a good afternoon. Talk to you later, bud.
Thank you very much.
All right.
Bye-bye.
So we're going to go back to ANOC, but listen up, employers. If you have not done this, don't ignore it. It's just something you as the HR director or as you, the employer, my friend Tom Shute and I are meeting right after the show. You need to do this. My friend, Ron, no last names, called me. And by the way, Courtney, great job with the Healthcare Council board meeting the other day. We heard from Trip Pilgrim from Vanguard, and he did a great job. Profit is not a bad thing. For-profit is not a bad thing. Christine, my friend, was adamant about you are not going to ignore the people that really need care. He handled it pretty well. He handled it on a 100% basis, about a 96, 97. which is a high A grade, you're not going to hit 100% with every question that you get. You're just not. But what his answer to Christine, and Christine's an extremely intelligent woman, was, we are not going to turn away the people with no insurance. That's the one thing that scares people. So great job, Healthcare Council. I'm on the board. And we had a board meeting. Great job, Tripp. I feel you were honest, you were sincere, and your message got conveyed. And it's get on board because we're coming. And I hope Governor Malloy can see that they are coming and that they are actually looking out for the best interest in the hospital. They need to turn around some of these in-debt hospitals. I feel Darlene Stromstead is doing a phenomenal job. And I saw a letter to the editor. I don't care how much money she makes. She works her butt off. She works 7 days a week. My friend Chad Wabel also. It's not our business. If we want to make that kind of money, we should have studied, gotten good grades, gotten those degrees, and gotten those jobs. If you're going to be the CEO of a hospital, you deserve as much as you deserve. It's a very, very stressful job. You've got a lot of lives on your plate and a lot of HIPAA compliance and a lot of employees and a lot of labor negotiations. There's a lot to it. So cheers to you. The exchange notice. Ron called me in the morning. It was actually an early riser. He called me like 7:30. So he said, hey, I listened to you. It's www.dol/government/EBSA. You've heard me with Carmody and Torrance, Chuck Stoller, and Mark. We have been plugging this to you. If you do not do the notice yet, you're missing the boat. You've only got 5-6 more days left. So the notice is www.dol.gov/EBSA. And you can always call my office if you forgot this, but you go on, you click on the right. It says Affordable Care Act. It's in red. Second bullet. Click on the right, Affordable Care Act. Go down to the middle of the second page. Click on the word model notice. So for you HRs out there, www.dol.gov/EBSA. EBSA. It'll come right up. And my staff did such a great job. Very proud of them. With healthcare reform, Patient Protection and Affordable Care Act, signed into law on March 20th, 2010, it is now mandatory that we, as your insurance agents, inform you of one of the laws that is still required. It is imperative that you, as the employer, inform your employees of the insurance exchange. The insurance exchange is called Access Health Connecticut. So Gene and I are both licensed and certified now. I'm very proud to say that. I still don't have my 10-digit code. But on October 1st, you will be able to shop for insurance on the exchange. Great article in the Republican American. Today's paper, Wednesday, page 3A, middle-class families brace for higher costs. Yes, that's going to happen. This Affordable Care Act is for the lower-income people because the lower-income people will receive some form of subsidy to make it affordable. It's going to help my favorite people, the older sick people, because they can't get insurance. There's pre-existing condition clauses. So that's, I know, Ferris, you're out there listening, baby, but the one thing I do like when your mom dies of breast cancer and you take her off life support, you do get a little sad because someone had bad DNA. So the guaranteed issue portion is the only portion I actually like of the law. It's called the Affordable Care Act, not Obamacare. All right, so let's try to get that right, too. It's going to hurt the younger people. I was talking to my buddy Ernie today, and he's only in his 20s. He's like 26, 27, and he does well for himself. He's a manager at a very successful deli chain, and he's going to get hurt because his premium on the exchange without the subsidy is going to be about the same. So he and I spoke. He said, if you don't mind, I'm going to ask my employer. I just want to keep what I have. One thing that is different is going to be the network. It's going to be a Pathway X network that you will have to use. With the certification, you can go online and just click some buttons and get it, but it does help to have an agent. We are paid by the insurance carriers. We are paid 2 to 3% depending on the dollar figure and depending on the families. We make $9 a person, works out to about 2 to 3% of the monthly premium. We do it in bulk. That's how an insurance agent makes the larger sum of their money. You can't just get one client. You have to get 2 to 3 a day. but it's good money. It's hard-earned money, and I feel it's important to have an agent. So if you're out there and you're interested in the marketplace, October 1st starts, accesshealthct.com. But if you buy from the exchange, you're not going to have anyone to call ever for advice or for help with claims. Claims are those funny little things that you actually put in when you have insurance. So I know you all think you're invincible out there, and you're perfect, Superman, Superwoman, Wonder Woman in your case, ladies. But you would need an agent. An agent fights for you when it comes time to getting claims denied. You get a claim denied, I fight for you. I call the carrier. I do a peer-to-peer, which is your physician and their in-house physicians at the carrier. You've heard my guests call in and say, you know, blah, 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 blah. I'm a great agent, but every day I have to earn that trust from you. I don't just sit on my laurels. So if you're going to buy it from an agent, hopefully from me. Why? Because I can work with the healthcare advocate, which is Victoria Veltri, my friend Maureen Smith. The Office of the Healthcare Advocate fights for you, the people. Will the prices rise? Yes, the prices are going to get a little expensive, which is the only bummer. And my poor employers out there, I feel bad. Talked to my friend Jeffrey yesterday. He's like, whoa, my price went up a little bit. Yes, bud, it did go up, and it's going to go up. You and your beautiful wife may qualify for some subsidy through the exchange, but I really doubt it. You have a beautiful home, you have a very successful business, and it just might not happen. We'll run it on October 1st, but you have a very good plan with your carrier. All right, so my friend Ted at B&N, get your wines over there. I used to have a client, Prospect Liquor Cabinet, but they sold. So I then changed, and they've just treated me well. The wine's always good. My wife likes, hey, babe, what do you like? It's Blackstone Merlot. She likes a Blackstone. And I'm always open for a nice glass of red wine with a meal, especially with a steak or some pasta. How are we looking, Producer Tom? You want to take a break now and run it, or you want to go a few more minutes?
We can go a few more minutes.
All right, we're going to go a few more minutes. Let me talk about the next item. Annual notice of change, done, checked off. Actually, ladies, I didn't run out of topics today. Thanks for forcing me to go. I was dragging butt this morning, so I was tired. I'm like, I don't even feel like it. But once you get behind the mic, you know you got to help the people. So that's what we're doing. Any of you out there that have questions on your annual notice of change, it's 203-757-1320. Any questions on healthcare reform, call me up. Anybody not know where to get the form for the mandatory notice for the employees? My buddy Sandy and I were already compliant by like 2 months. All right, High Deductible Plan F by Anthem Blue Cross Blue Shield. It is the plan that's about $38 to $40 a month. It used to be $41.89, and then Anthem lowered it slightly. I think it just say $40 for easy numbers. If it's $38, don't shoot the messenger. But anyway, well, with gun control laws, don't get mad at the messenger. But anyway, High Deductible Plan F, $2,000. Anthem Blue Cross Blue Shield, owned by WellPoint, WLP, is doing away with that plan. The adverse selection just doesn't make it right. For $480 a year, basically it's $2,400 for the premium at $40 a month, $480. So you got a $2,000 deductible and a $480 premium. So their exposure is $2,480. After that, they have to pick up 100% of the claims. So it's just not working. With a High Deductible Plan F, you retain or keep original Medicare, which is Medicare A and Medicare B, and then you shift risk to the Medigap policy or Medicare Supplement, and that's High Deductible Plan F. Anthem's doing away with that one. That I'm legally allowed to say because that has nothing to do with ANOC, has nothing to do with Medicare Advantage plans. That's just a blatant policy cancellation. So I'm going to touch on a woman who's very intelligent, always writes nice articles. Monday, September 23rd, 2013, in the Republican American, a woman named Pamela Yip. I believe this might be the second time I've spoken about this woman. She writes a commentary piece. It's always in the business section on the left column. Choosing Medicare coverage options. So I read it. I read it actually twice today. I read it in the morning when I read my paper, and I read it before this show. you're basically getting Michael Regan doing this every week, every Wednesday. So her article went over Medicare Advantage, Medicare Supplement. I talk about it all the time, every show. So pat myself on the back a little bit there. Nice job, Regan. She did do a good article. Remember, Medicare Advantage is not a Medicare supplement. It is nothing. It doesn't look like it. It doesn't sound like it. It's a complete separate private insurance that you buy through insurance companies. A Medicare supplement or a Medigap is 80% picked up by the government. A is generally free. If you've worked 40 fully satisfied quarters or 10 years, you will get A either by being disabled for 24 months or longer, or you've turned 65. Your initial coverage election period is usually for most Americans at age 65. You get that for free. Medicare Part B, you will pay for. The Part A covers care at hospitals. Part B covers services provided by the doctors. Most Americans with a legal Social Security number, I must add, have to pay Part B premium of $104.90. If you're affluent and you make more than $85,000 a year, which is usually Social Security check, dividends, rental properties, your Part B premium goes up. It's called an IRMAA, I-R-M-A-A. If you're married, couple, filing jointly, and you make more than $170,000, your IRMAA, and I do have some attorneys out there that really are paying $350. A printing company used to be out of Waterbury. They've moved now to, I don't know, Harwington or something like that. But their premium is $500 each a month. And they're always like, God, this is so expensive. That's life. Stop making $1.5 million a year. Or you know what? Good for them. I like affluent people. I like people that work hard, and I do not knock it. When someone gets a new car, I always say, good for you. You're not flashy. You're not showing off. You worked for it. You got to have a payment, or if you buy them outright, good for you. Commercial break. Yeah. We've got 3 sponsors to plug, and then we will be back in about 2 minutes. Thanks so much for listening. Medicare and You. I'll talk to you in a few minutes.